Hi everybody, this is Hope Noble from Let's Vent with Hope. Today we got Dr. Guys, and I just want you to know more about Dr. Lobai Esekuna, opposite Office Bar next to Ilacent Laboratory. So how are you, sir?
Hi, good afternoon and welcome.
I'm good.
Thank you very much.
I don't know whether I'm pronouncing it well. Is it Dr. Lobai or Lobai?
Lobai.
Lobai.
You pick your choice.
So for that same name, if you can tell us more about you, who's Dr. Lobai, where he was brought from, and where do you come from? Because to be honest, I don't know.
Is the surname throwing you off?
Yeah, I'm like, Lobai, is it Zulu, is it Indian? So I'm not sure.
Yeah,
Yes.
no. My roots are stem from Namibia.
Namibia.
Yes, but I've been born, I was born in South Africa
Okay.
to a single mother.
Alright.
And yeah, she raised me until I was about 7, 8.
Okay.
When she got married to a South African, and yeah, that's where we find ourselves.
Oh, it's Lobai.
Yes, and I stayed in Pretoria for a while.
Okay.
From Pretoria, I went to boarding school at the age of, I think it's around about 9 when I went to boarding school. I grew up at boarding school right up grade 10, which was those years, 10 and 8. And yes, that's my life story. Raised by a single mother for the beginning of my life.
Okay.
And after that, my stepdad took charge, and yeah, we lived with him until the time that I went to go to boarding school.
Okay.
Yeah.
Why medicine? Like, why being a doctor? Because like everybody has a story to tell about their career.
Yes.
So I just want to know, why did you choose this kind of a career?
It's quite fascinating. I had a choice between becoming a Catholic priest and becoming a doctor.
Okay.
So I thought, well, not being able to do the healing of the spirit
Okay.
through being a priest,
Mhm.
I'll heal the body.
But
I
now
will work.
I'm confused. Who wanted you to be a Catholic priest?
No, because I grew up in a Catholic school.
Yes.
It's a Catholic boarding school.
Yes.
So it was always that, you admired the priest, you admired their spirituality,
Okay.
everything about them. You just grow to
that.
because that's all we knew growing up as kids.
Okay.
And I think I was around about standard 9 that time
Mm-hmm.
when I had to make a choice. And spoke to my mother about it. She said, you know what, it's your life, my son. You do with your life what you need to do. And then I had the option to apply to university, and because my results had to be in at the end of standard 9, what is it, standard 9 grade?
Yeah, grade 11. Grade 11.
Grade
Yes.
11, I had to submit my results,
Mhm.
and because that was the first round of selection, and yeah, it was a hard one to choose, as I said, but afterwards I chose, okay, I think.
But was it a matter of passion? Because I believe when you choose a career, it's all about passion. Are you passionate with people?
No.
What is your character?
Most definitely, yeah. If you look at the choices that I had to make,
Yeah.
it was either healing the soul,
Okay.
praying with people,
Okay.
and ministering to people,
Yes.
and healing people,
Yes.
physically healing people. So it was always my passion and to deal with people, to work with people.
Okay.
Yes,
Now we're talking about the struggles of studying at that time. Did you have any struggles in your journey? South Africa, you know the challenges.
We
And
know.
you've been raised by a single parent, right?
That's
You've been
correct.
raised also by a stepdad,
That's it.
which these days we are skeptical about it. Like, we're scared of being raised by stepdads, due
Yes.
to what is happening in South Africa.
No,
But in your case, tell us about your journey being raised by a stepdad and you having struggles as a doctor.
I think, my stepdad was fantastic. Really, really fantastic. I've got 2 other siblings.
Yes.
And yeah, I never felt, that
He's not your dad.
he's not my dad. Whatever was shared in the home, that was for the part that I was back from boarding school and being at home and all that. I never felt like
he's not my dad.
So it was great growing up with him and with my mom, obviously.
Yes. And then the career now. What were your struggles? What is it that it's your call? Like when you think about him, like in this journey, or was it so easy for you?
I mentioned that I had to make the choice between becoming a priest and becoming a medical doctor. And it was quite difficult to make that choice. Very, it was challenging. And I think right up until I had to submit my final Standard 9 results to the university, and that I think even the priest at where I attended church and the nuns and all that, they were always convinced that this is the one that we have. We've caught him. And I think they were very disappointed at the time that I told them, you know what, the choice is very difficult to make, but I think I will heal people in another way, physically. Yes.
In your family, do you have doctors, or you were the first one to break through?
Fortunately, yes. I'm
the first doctor. Yes. So now you came to Emadeni. How did you come about it at Sekunda? And as you said, I think in the short clip you did mention that you were working somewhere. So if you can tell us about that.
That's correct. I think if you have a look at my wall, I was a very indecisive person in terms of career paths in medicine. So I did occupational medicine, and we started a company in Sekunda, offering occupational health services. And I can elaborate on occupational health services as this thing, but I don't think it's, it speaks for itself. It's basically declaring people fit for work.
Yes, exactly.
And that's a requirement, a pre-requirement for settlement. So that was our primary function in Sekunda for the while that I was working here. I did exclusively occupational medicine. And I was also very, my career, as you can see, very doubtful as to know what do I do beyond occupational medicine, because after a while it becomes, the same old thing over and over again, and you need to diversify. And if I again can point you to the qualifications that I've gone through, I've got 4 degrees.
4 degrees?
Yes. I've got a master's degree in family medicine, apart from the basic Bachelor of Medicine and surgery. Then I did some travel medicine. And the other part of my career, another passion that I have as well, is basically just, looking at people and how I'm going to refer them, if they need to be referred. But most of the work I know with the occupational, the family medicine, the degree, it was a 4-year degree that I had to do in family medicine to be able to expand my horizon onto how I treat my patients as a primary healthcare physician.
Now, we have so many doctors, we need to admit, we have so many doctors at Sekunda. What's different? What outstands with your work?
Ngiyakhuluma, ngiyathetha,
all the languages.
Yes, so I in that position that I can accommodate and listen to the patient in depth in what, because in part of our work it's not just healing the physical. You find people going through difficulties in life, and they will express those, presenting with medical symptoms and medical things that are not really there, but it's the way of approaching the doctor and a cry for help. And I think as an experienced family health physician, that's where you learn and you pick up to see the difference, and that this patient is actually here with a deeper problem than just the physical headache that she's complaining of, or the rash behind the ear, you know, that kind of a thing.
Okay.
Yes, that's important, but you pick up in the consultation that there's much more that she wants to share with you, and it's a cry out for help. And I think, yeah, that puts me in, I think in a
better position, I think.
Yes, I
Better
think so.
position of being a doctor.
Yes.
And what I want to know, do you ever get emotional when dealing with certain clients? Were you ever in a time where you just get emotional when you're dealing with your clients and you're like, this is it's too much for me as a doctor?
I won't say that it's too much.
Okay.
I would say yes. You sometimes, it's life experience. It's what people go through. It's what, and you can, as I say, you can pick up the nuance as to, you know, why that person is really here.
Okay.
It's not the headache that started yesterday that brings her here or him here, but it's the struggles in life. And if you pick up on the struggles in life and all that, you know exactly, if you can't deal with the problem, at least I know of the specialists that will be able to take care of that patient. Unlike, you know, being a surgeon, for instance, not that I've got anything against surgeons, but what I'm saying is it's not like, you know, there's a lump here, cut out the lump. There's more to that person than just attending to the lump there. And I think that sets us apart as family physicians as to what we do.
Does your career ever like affect your family? Is there a way you can attach between your career and family? Because we know some other jobs, right? There's a time where you just like, no man, this is too much work for me. I can't be with my family. So what about you? Does it ever clash?
I'm in the position that I'm married to a nurse.
Oh,
a nurse and sister.
Okay.
Yes. Tulofelo is the name.
Okay.
Yes. And I think we share a lot.
Okay.
You know, sometimes even in the evening around the dinner table and all that, you know, she still works in occupational health.
Okay.
And as I said, I've branched out of occupational health, although some of the patients that I see is still occupationally related.
Okay.
But yeah, we share, you know, what the day is all about. But it's not only just about medicine and about, it's a diverse conversation.
So what is it that you really offer? Like what kind of, if people come to you now, what kind of a doctor are they coming to? Because they need to know.
They have the option. I still have a lot of occupational health experience, so I can help with in that respect. As I say, as a family physician, family health physician, for which I studied 4 years, 4 long years. You know, you learn to deal with primary health on an elevated level, if I can put it in that sense. You know, you get a better insight into the person, insight into the problem. A lot of problems, it's easier for you to identify, and you can then, if necessary, you can refer to the necessary specialist using your background experience and using my, you know, my knowledge of a wide field in medicine. Yes,
So manje ke doctor ngisitshele ke manje. You said uyakhuluma, right? Now I'm testing your language. Ukuthi umuntu
I feel much better, comfortable when I speak to my patients.
I'm a take me as a patient. Ukuthi if a person, I'm a scenario now, ukuthi doctor now, ngiphethwe yindlebe. What are you going to respond to me?
Yeah, ngiyazi ukuthi ithini.
Okay.
Indlebe. Your ears.
Your ears.
Exactly.
Yes, you know. So, doctor, if you can just tell people a little bit more about your insight, what is it that you're really looking for, like uband when they come to you, and what you are really expecting from people, and what is it that you want within your plate. So if you can just tell our people or communicate or engage, what kind of a doctor are you? What are you helping with? What is it that you want Dr. Lobai?
I think my first priority will be distinguishing between the real sick person
Okay.
that needs immediate attention.
All right.
And yes, as I say, I can go that far to treat a patient, but I am not shy to call in expert help from the professionals, specialists in the field and all that. And the fortunate part is that, as I say, the exposure that I had, I know which specialist to consult and where to refer the patient if they need to be referred.
Okay.
But a lot of the conditions and all that, I'm in the fortunate position that I probably, if I can put a percentage to it, probably around about 60-70% of the patients that present, I will have the expertise, the knowledge to, to treat at the primary level instead. And I take it that, you will not know everything as a doctor.
Yes.
Just as a neurosurgeon will not know everything about orthopedics or, that's why there are specialities. And but I think the fortunate part for me is that I can distinguish and get the patient into the right hands at the right time.
That's what you promised them.
That's
Okay, do you have any social platforms, Facebook, where we can check you out, guys? Or
I do. I actually registered a Facebook page with the help of my son.
Okay.
I think it's Facebook and what is the other one?
The Facebook, Instagram.
Instagram.
TikTok.
That's the.
Do you have a TikTok?
Yes. Another TikTok page yet.
Okay, so it's
we're still
Instagram.
working on, hopefully.
So it's Instagram and Facebook. What is the name of the page? Is it still Dr.
No. We work with the this thing. It's my word.
You forgot the name, huh?
No. I didn't forget the name.
Okay.
It's just I will give you the card.
You give me the card, so I'll be able to tell people.
You will tell.
Okay, so if you can just tell our viewers about the numbers that you have, where they can contact you, and maybe do you have WhatsApp where they can be able to WhatsApp you or?
Yeah, I primarily use the my personal cell phone number, and then we've got a number for the rooms.
Okay.
The number for the rooms.
Yes.
Again, it's not one of their direct numbers, and people might get confused because it starts with a 01.
Oh, okay.
But again, that I can offer it to you, and you can put it up on the page if necessary.
Will you be able to mention it on our viewers? Do you know them? Okay, your personal number then.
My
your
personal number is
yes.
073 070 2646.
Okay.
And yeah, they can use the same. Obviously, these days with technology, you can link the number to my Facebook.
Yes.
No, not Facebook. With
WhatsApp.
the WhatsApp, yes. And I'm if I don't answer immediately, I will definitely get back to the person I guarantee within 20 to 25 minutes, because if I'm not busy with something.
Oh, that's alright. Oh, guys, you heard from Dr. Lobai at Sekunda, opposite of Spa, next to Lassette, where you can be able to find him. I had a great chat with him today, so if you can be able to come here whenever you need help. Did you hear him? He has 4 degrees. So this is Home Global from Lesotho. That's alright.